Struggling with yellow flaky fungal nails? You're not alone. Thousands of you have asked, how do I use nail lacquer properly to get results fast? In today's video, I'm answering your top questions: how often to apply, whether you can reuse the tools, and the secret to curing fungal nail infection. Stick around because in just 30 seconds, I'll share a game-changing tip that could save your nails. Nail lacquer should be applied once or twice weekly. Daily application offers no added advantage and we do not recommend it. If a doctor recommends daily use, verify if they are truly a dermatologist. I have discussed how to spot a fake doctor here. After the last step, allow the nail to dry completely. Do not put your nails in your mouth. Avoid prolonged water exposure immediately after application, such as bathing, dishwashing or swimming. Do not peel the nail lacquer or damage your nail. Do not expose the nail to alcohol-based solvents. Nail lacquer should be applied to top of the nail surface after filing down the infected area. It is not designed to go underneath the nail, as it may not penetrate it effectively and could irritate the nail bed. If the infection is under the nail, consult your doctor. The nail filer that comes with the pack is made of sandpaper or cardboard and cannot be reused. If you have multiple affected nails, use a fresh file for each nail. Let's say I have two fingernails which are affected. If I use a single nail filer for the first affected nail, I'll have to discard it after filing my nail, and I'm going to use the second strip for the second nail. So if you have multiple nails, you'll have to keep changing the nail filer. The same nail filer that is used for this nail cannot be used here. When the applicator is not cleaned, fungal spores from the nail may contaminate the nail lacquer in the bottle and the infection can spread to other nails. The nail lacquer has a cap with spatula. The spatula is fixed to the cap. Nowadays, the nail lacquers come with disposable spatulas. In case if you have a fixed spatula, after using the spatula for the affected nail, it has to be cleaned with an alcohol swab that contains 70% of isopropyl alcohol. The best way to remove an old nail lacquer is to file the nail. Use the alcohol swab provided with the pack. If you have exhausted these, you can alternatively use a cotton ball soaked in spirit, that is 70% isopropyl alcohol, to wipe the nail. Avoid prolonged exposure, including cooking, cleaning and washing with detergent. Do not try to be your own doctor. This will do more damage than good. Unsupervised use of oral antifungals can lead to liver damage. Nails must be inspected for correct diagnosis and samples may need to be taken for investigation. Therefore, please go to your nearest dermatologist. Results from nail lacquer for onychomycosis takes at least 3 to 6 months for fingernails and 6 to 12 months for the toenails to show up. Healthy nail grows out slowly, 1 to 2 mm per month. If you want to calculate the rate of your nail growth, watch this video. This formula gives the exact answer to your question.